Hi, my name is Heather Valancourt and I'm a TW student, and I am going to be demonstrating a range of motion manual muscle testing on the thumb, fingers, and wrist. Some general instructions before administering any functional assessment would be to explain to your patient or client what you're doing. Also, make sure that you are checking throughout the assessment regarding their comfortability and also their pain. Positioning in a range of motion and manual muscle is always important, as you want to make sure there is exposure to the joint that you're measuring. Also, make sure you're positioned at an angle that you can get full resistant when you're doing the manual muscle. You always want to measure twice and do both sides. For the instructional purposes for this video, we will be measuring once and we'll be doing only one side. We're going to start off with measuring range of motion of a wrist flexion. We're going to have the axis of the goniometer placed at the wrist joint in line with the base of the third metacarpal. We're going to have the stationary arm actually in line with the midline with the forearm, and we're going to measure with a movable arm in line with the third metacarpal. What we're looking for is 0 to 80 degrees, and it looks like he's right at 63 degrees. Okay, now we're going to measure wrist extension. We're going to take the goniometer and have the movable arm in line with the third metacarpal, just like when we were doing wrist flexion. And we're going to have the stationary arm along the midline of the volar surface of the forearm. The actual axis is placed at the wrist and in line of the tendon of the palmaris longus, and the movable arm is parallel to the longitudinal axis of the third metacarpal. We're looking here for 0 to 70, and it looks like we have 70. We're going to be measuring wrist ulnar deviation, and I'm going to have the client can you pull your hand towards your pinky? And you're going to have the goniometer placed on the axis of the dorsal aspect of the wrist joint in line with the base of the third metacarpal. And then another arm in midline of the forearm and of the dorsal surface, and the other arm along the midline of the third metacarpal. And what we're looking for in this measurement is we're looking for 0 to 30, and we have 30 degrees. Now we're going to move on to wrist radial deviation, and we're going to have the client, can you move your hand towards your thumb? I'm going to flip. The goniometer is placed at the aspect of the joint in line with the base of the third metacarpal again, and the stationary arm along the forearm, and the movable arm in midline with the third metacarpal. And we're looking for 0 to 20, and we have about 15 degrees. We're going to be measuring MCP flexion of 2, 3, and 4 of the fingers. We're going to start with number 2. And we're going to have our goniometer placed, the axis right here at the MCP joint, and we're looking for 0 to 90 degrees, and we have 73 degrees for this one. So let me write that down for number 2. Okay, now we're going to go on to number 3, and I'll go a little bit better. So we have 75. Okay, right here. Looks like that's right at 70. And the last one here, go ahead and bend your, okay. And we have about 73. Now we're going to be measuring PIP flexion. We're going to take the goniometer and the axis is on the dorsal aspect of the PIP joint, which is this joint here, the finger being measured. The stationary arm is in the midline of the proximal phalanx of the finger being measured, and the movable arm is on the middle phalanx of the finger being measured. For this, we're looking for 0 to 100. So we're going to place the goniometer here, and we have right at 100. And let me write that down. Okay, And we have right at, I'm going to say 90. A little less on that one. And then we're going to go to number 4. And we have right at 90. And then the last one. And we have about 92. Now we're going to be measuring the DIP flexion, and we're going to have your client make a claw for me, and we're going to be putting the axis on the goniometer at the DIP joint, and we're looking for 0 to 90, and we have about 85 degrees there. Good. Now we're going on to the third finger, and okay, and he has about 87 degrees there. On to the fourth. Good. Yeah, 90. And the third, from the fifth, and then you have about 80. Now we're going to be measuring DPC, which is distal palmar crease, finger to tip distance. How we're going to do that, we're going to ask our clients to make a curl their fingers, kind of like a fist. And for this particular, you can see that there's no space, so he would have a 0. If, for example, the client was not able to fully close their or curl their fingers, you would measure it using the tip of your goniometer for each finger by centimeters and measure and document for each one. Now we're going to be measuring range of motion of the thumb. We're going to start with palmar abduction, and then we're going to move on to radial abduction. So for palmar abduction, we're going to have our client in midpoint. We're going to have the axis of our goniometer on the CMC joint of the thumb, and we're going to have our movable arm in midpoint with our thumb, and then the stationary arm in line with the index finger. We are looking for 0 to 40 degrees, and for this we have right at 40 degrees. Let's write that down. Now we're going to move on to radial abduction. We're going to have our client palm down, and then we're going to have him extend his thumb out, and then we're going to have the goniometer again in the same location with the CMC joint and the movable arm and midline with that, and the index finger with the stationary arm, and we're looking for 0 to 40 degrees, and we have 0 to 40 degrees. Now we're going to be measuring thumb opposition, and how you do that is you have your client take their thumb and touch it to the tip of each finger one at a time. Can you touch your thumb to your finger, to your pinky finger? Next. Continue on. Okay. If for some reason they can't get full range of motion, then you would take your goniometer and use the centimeter at like a ruler, and you would measure from the thumb, the distance between the thumb and the finger that they weren't able to get full contact. He would be a 0 if he can touch, but then you would just measure in centimeters. For example, this would be 3 centimeters. Now we're going to do manual muscle testing on the wrist, and we're going to start with the flexors, and specifically we're going to be doing manual muscle on flexor carpi ulnaris. So you'll have your client, and I'm going to ask you, can you please flex your arm like this and over to the thumb side. You're going to place stability here at the wrist, and you're going to apply resistance at the 4th and 5th metacarpal. Don't let me move you. He has full resistance, and that would be a 5. However, if he had problems with range of motion, we would put him in mid position with gravity eliminated, stabilize at the same place, and also give resistance at the 4th and 5th metacarpal. We're going to be doing manual muscle on the flexor carpi radialis, and I'm going to ask my client, can you flex your arm and kind of tilt it to the direction of the pinky side. You're going to stabilize here at the wrist, and you're going to apply resistance at the 2nd and 3rd metacarpal, just like this. Don't let me move you. Great. He would be a 5. And again, just like when we were measuring flexor carpi ulnaris, If for some reason the patient had a problem with range of motion, was not able to do that, we would put them in mid position, stabilize the wrist, have them flex going towards the pinky side, and apply resistance in the same spot. But for this demonstration, he got a 5. Now we're going to be doing manual muscle testing on the extensors. We're going to specifically start out with extensor carpi ulnaris. The client will be palm down, and can I have you flex your, extend your wrist and over to the thumb side. Great. I will stabilize here and place resistance at the 5th metacarpal, pulling towards me. Please don't let me move you. He has full resistance with complete range of motion. He would get a 5. If again we had problems with the range of motion, he wasn't able to do that, then we would put him in mid position and apply resistance at the 5th metacarpal. Now we're going to move on to extensor carpi radialis brevis, and I'm going to have the client pull your arm in, if you can, and again I'm going to stabilize here at the wrist. And can you extend your arm out for me? And again towards now to your pinky side. And then I'm going to place resistance at the 2nd and 3rd metacarpal. Please don't let me move you. Great. Again, he got a 5. He had a complete resistance and complete range of motion. Now we're going to do a manual muscle on the flexor digitorum superficialis. And I'm going to actually be blocking digitorum profundus as I'm testing this particular superficialis. So if you can please flex here at this joint and don't let me move you. Great. Okay, put it down. And then that joint, don't let me move you. Okay, good. And here, don't let me move you. And here, don't let me move you. Okay. Profundus, and we're going to apply stability here across the hand, and go ahead and flex the finger. Great. Flex for me. Great. One more time. And he got a 5 on both the profundus and the superficialis. And now we're going to be testing manual muscle on the lumbricals. And I'm going to have my client, can you please flex your fingers up like that? Great. And I'm going to apply stability here. And then I'm going to apply resistance at the proximal phalanx of each finger. Don't let me move you. And he had complete resistance and range of motion for that, so he would get a 5. Now we're going to move on to the extensors of the fingers. We're going to start off with extensor digitorum, and then we're going to move on to extensor digitorum minimi, and then indicis. So we're going to start with extensor digitorum, and can you please make a claw like this? I'm going to stabilize here, and then I'm going to apply resistance at the phalanx, the proximal phalanx, 1 digit at a time. And he has complete resistance on those, so he would get a 5. Now we're going to move on to indici and minimi. If you can please make like a longhorn sign. I will stabilize here, resistance at the proximal phalanx, switch over here, and he got a 5 on both of those. Now we're going to be doing manual muscle on the dorsal interosseous muscle and on the palmar interosseous muscle. So first, you have your client up on their elbow and palm facing me. And can I please have you extend your fingers? And then I'm going to be applying resistance to each finger toward adduction, 1 at a time. And he gets a 5. He has complete resistance. Now moving on to the palmar interosseous. Please put your fingers together and don't let me move you. Okay, so pretty much he had a 5 on all digits except for digit number 2, and he had a little movement there, so I'll give him a 4. Move on to the abduction digiti minimi, and I'm going to have you go ahead and move your finger out to the side, and don't let me move you. And great. And now we're going to go to opponent's digiti minimi. If you can turn your hand up, go ahead and take your pinky, top of your pinky to your thumb. You're going to stabilize here at the second and the third metacarpal, and then you're going to apply resistance here to try to pull the pinky away, and he gets a 5. Now we're going to be measuring the flexor pollicis longus, and we're going to have the client in mid position, and I'm going to stabilize up here closer to the PIP joint, and we're going to have him go ahead and bend his thumb, and then I'm going to apply resistance here. Don't let me move you. Okay, great. He would get a 5. We're going to move on to the flexor pollicis brevis, and I'm going to stabilize further down, and I'm going to have him bend here, and don't let me move you, and I'm placing resistance at the proximal phalanx, and he does that great, so that would be a 5 as well. Now we're going to be measuring the extensor pollicis longus, and I'm going to have the client in mid position with his thumb extended, and I'm going to be applying stability close to the PIP joint, and I'm going to say, don't let me move you. And he has complete resistance, and he would have a 5. Now we're moving on to extensor pollicis brevis, and we're going to have the client again in mid position, and we're going to have him go ahead and extend his finger, okay, and I'm going to be applying support here, and I'm going to be applying resistance here at the proximal phalanx. Please don't let me move you, and he would be getting a 5 on that. Now we're going to move on to the adductor pollicis of the thumb. We're going to stabilize here at the metacarpals, second and third metacarpal, and I'm going to have my client put his thumb in adduction, and I'm going to apply resistance here at the proximal phalanx. Please don't let me move you. Okay, good. And now we're going to move on to abduction pollicis longus, and you're going to be laying palm down, and please put your thumb out, and don't let me push your thumb in. Great. Now we're looking at abduction pollicis brevis, and I'm going to be stabilizing at the second and third metacarpal, and I'm going to be applying resistance at the first metacarpal, and my client's going to be in supine position. I'm going to press down here. Please don't let me move you. And he got a 5. Now we're going to be measuring opponent's pollicis, and I'm stabilizing at the second and third metacarpal, and I'm going to be applying the resistance at the first metacarpal. So you want your client, please touch your pinky to your thumb, and don't let me move you. And he would get a 5. Okay, hi Edward. I have reviewed your range of motion scores and also your manual muscle, and they're all within normal limits. And for example, your manual muscle pretty much was all 5s, and you don't need any kind of occupational services at this time.
Okay.